Hi everybody, today we're going to be going over the innominate bone. So the innominate bone is one of your hip bones. You actually have two. This is what one of them looks like, okay? Here's like a little 360 view. And they're actually going to come together like this. So you're going to have another one on this side and the points are going to come together like this. And the sacrum, so the bottom of your vertebrae, right, is going to form the back, okay, or the posterior. And then that's going to form basically your pelvis, okay? So we're just gonna look at one innominate bone right now. This is actually gonna be your left innominate bone, right? And how we know that is we orientate ourselves, right? So this is the most important part when you're dealing with the innominate bone because this is one of the more difficult bones in the body. I'd say it's probably the most maybe the second most difficult compared to the skull, right? So the skull is a little bit more difficult, but the innominate bone is tricky because it has all these different views, right? So you can have this view, this view, this view, this view. And if you're taking anatomy out of class, you can be tested on any of these, right? So I'm going to teach you how to orientate yourself, right? So right now, if I show you this view, you're looking more at a medial view, right? If I show you this view, this is going to be more of a lateral view. And it's easy to tell because this is the acetabulum, right? The acetabulum is where the head of your femur, so your thigh bone, is going to articulate. So that head of the femur articulates with the acetabulum, making up that hip joint. So you know that that's always going to be lateral, right? Now we just go ahead and start off with the top, all right? So the innominate bone can be divided into three parts, all right? This up here is all of your ilium, okay? Your ilium. Down here, this part, okay? This is your ischium, and right here would be your pubis, okay? How I remember that is the pubis is pointy, right? See that little point right there? It's probably better from this view. I like to remember pubis point, right? So that's an easy way to remember that that one's pubis, okay? This one is gonna be your ilium. So if you ever hear iliac, that's referring to the ilium, all right? Ischial would be referring to that ischium, this area right here, right? And then pubic would be referring to usually this pubis area, okay? So now that we got that out of the way, we can go ahead and start naming things on the actual ilium part, right? Starting off with the iliac crest, all right? This is the iliac crest right here, okay? Then if we move down, we have this area right here. And if you can't tell, it has like a little bit of a divot, right? So if I poured water in here, it would hold it, kind of like a bowl, all right? So there's like an indention on this side. That being said, this can be referred to as the iliac fossa, okay? The iliac fossa. But as you all know, in anatomy, a lot of things have multiple names. So this can be known as the iliac fossa or the iliac ala or the iliac wing, okay? However, if I show you the lateral or more posterior side, okay, notice how this is not indented, okay? It is not bowl-shaped. That means it cannot be considered a fossa. So this side would just be the iliac wing or iliac ala. But when looking at that more medial side, right, that indention, okay, it can hold a little bit of water. That would be your iliac fossa, iliac wing, or iliac ala, okay? Now we can move on to your spines, right? So each innominate bone actually has 5 spines. So that brings a total of 10 in your hip bones, right? Because we have 2 innominate bones. And 4 of those, all right, on each bone would be on the ilium. So you have one right here, right? This little part that juts out. You have another one right here, okay? Another one right here. One right here. And my finger's covering it, but one right here also, all right? Those are 4 of them, and those 4 are on the ilium. So those are gonna be known as iliac spines, okay? Iliac spines. Unfortunately, they have more to the name, right? So this one is going to be referred to as the posterior superior iliac spine. This one is going to be your posterior inferior iliac spine. This one is going to be your anterior superior iliac spine. And this one's going to be that anterior inferior iliac spine. All right, now, a lot of people have trouble remembering the names of the spines, right? Because there's 4 and they're all on the ilium. But I have a trick for you, all right? This is how I remembered it. Those posterior spines are always gonna be on this bumpy surface, all right? This bumpy surface is known as the iliac tuberosity, all right? And if it's a posterior spine, it's gonna be on this, right? So no matter how I turn it, okay, you know, okay, that you can tell which one is on this side, right? So the bumpy, rough side is gonna have those posterior spines, all right? That being said, your anterior spines right here are always gonna be on the side of that pubic point, right? That pubis point, all right? So this side. So no matter how I orientate it, you know this would be anterior because it's on the side of the point, right? And you know that this one's gonna be posterior no matter how I pin it, right? So if I pinned it like this, and I asked you from this view what spine this was, you would say the iliac, anterior superior iliac spine, right? Because you know going down that that would be the anterior because it's on the side of this, right? That being said, how do we differentiate between superior and inferior, right? Superior means above and inferior means below. But when this can be orientated in any direction, okay, it's a little bit harder to memorize what that is. But I have another trick for you, right? If it's closer to the iliac crest, all right, the iliac crest, it's gonna be superior, right? If it's on the side closer to the ischium or pubis, it's gonna be inferior, right? So putting those together, you would have anterior, because it's on this side of the point, superior, because it's closer to the crest, all right? Iliac spine, all right? All of these are gonna have iliac spine in the name because they're all coming off of the ilium, all right? And that's pretty much all you see on the ilium part, all right? Moving down, at least on this view, right? Technically, we would be moving a little bit more forward or anterior if this was orientated like it was in the body. But if we go down here to the ischium, right, we can start to see more things going on, right? So we'll start with the last spine, all right? So this is the 5th spine. This is the ischial spine right here, the ischial spine, okay? Now, there's nothing fancy about it because it's just the ischial spine because it's the only one on the ischium. So how I remember that is only one on ischium, right? So you know that this one is going to be the ischial spine, right? So no matter how I orientate it, it's going to be the only one in that area, right? So this would be the ischial spine. Now, you'll notice above the ischial spine, we have this really big notch in the bone, right? This is called the greater sciatic notch. The greater sciatic notch, okay? And if we have a greater sciatic notch, we more than likely are gonna have a lesser sciatic notch. And we do, it's right here. So it looks like a little baby scoop taken out of the bone rather than this big scoop, right? So this would be that greater sciatic notch. This would be that lesser sciatic notch. Now, in the body, when you have the 2 innominate bones and you have all the ligaments and everything there, it is gonna form the greater sciatic foramen. So if you hear that term, they are related, okay? All right, now it's a little hard to see, but this line right here, right, that line is called the arcuate line. The arcuate line or arcuate line. And that's the line that you can see kind of going down across the 2 parts, right? Now, you also are going to have the ischial tuberosity, right? And that is this part right here, all right? So this little bumpy surface. If I turn it this way, it's a little bit more clear that why it's an ischial tuberosity. You can see that's a little bumpy, right? It's kind of all rough and stuff. So that would be the ischial tuberosity, right? Because we're still on that ischium. Now, the last part of the ischium, right, would be this, okay? Just this half though, right? Just this half. If I pan over here, that would actually be something different. So we're just looking at this half of this line, basically, right? This half is the ischial ramus, the ischial ramus. Now, if I move over here, this is now referred to as the inferior pubic ramus, inferior pubic ramus. So, two different structures, right? Why is it called the inferior pubic ramus? Well, it's inferior to that pubic tubercle, which is this little bump up here, right? That's your pubic tubercle, because we're now on that pubis region. However, if I pen this, you'll see we have another little line, right? This is going to be that superior pubic ramus, right? So, let me switch hands. Superior pubic ramus, because it's above that pubic point, all right? That's how I like to remember it. Then you have that inferior pubic ramus right here, and that ischial ramus right here, right? Okay, good. Also, on the pubis, we are gonna have this right here, okay? If you can see it. See how it's kind of rough, right? It's a little rough right here. All right, so we had our pubic tubercle up here, all right? And this is called your symphysial surface, symphysial surface. Now, here's the tricky part. If you have both innominate bones together, like you would in your body, okay, it would then be called your pubic symphysis, your pubic symphysis. So that's basically when you have these two innominate bones, all right, imagine my hand is the other one. When you have these two innominate bones together, all right, there's gonna be like cartilage right here, and they're gonna articulate with that cartilage and kind of come together to form the pubic symphysis, which would be in the anterior aspect of your pelvis, right? But when you're just asked about an innominate bone alone, that surface would be the symphysial surface, okay? Now, that doesn't leave a whole lot, right? We're still on this medial portion, but you can see this giant hole going through the bone from any aspect, right? Any aspect, you can see this giant hole going through the bone. That is called your obturator foramen, your obturator foramen, okay? So, that can be seen from any part. Now, we're gonna go to that lateral aspect, right? This is the more lateral aspect. And just a reminder, we had that anterior iliac, superior iliac spine, that anterior, inferior iliac spine, posterior, because we're on that big, thick part, right? You can kind of see it if I grab it like that, right? Your posterior superior iliac spine and your posterior inferior iliac spine, right? We also have, that ischial spine, right? We had right here our iliac wing or ala, okay? It was not considered a fossa, so it's just iliac wing or ala. And we had our iliac crest. So a few of these structures we can still see from this aspect, but we have something brand new, right? We have the acetabulum. That's this giant circle right here, all right? That's your acetabulum, all right? This is where your head of your femur is going to articulate to make up that hip joint, right? So you can see that it goes all the way around, all right? Except you have like a little notch right here. And if I kind of angle it like this, you can see it a little better. There's a notch, all right? That's your acetabular notch. And then if you really want to get into the specifics, you'll see that you kind of have an indentation and then a drop right here, right? So you go down and then it gets a little rough and it gets a little deeper right there. That would be your acetabular fossa. But usually this is just referred to as the acetabulum, okay?